a link in the chat. Also, Zufall staff will be sending that link to all attendees. So before we move to the wrap-up session, on behalf of Zufall Health Center, our sponsors, and the New Jersey Department of Health, I would like to thank you for participating in this year's conference. It has been a great opportunity for us to learn and network and and understand all the issues and that are happening out there in these rural communities and in the different disciplines. So I would like to pass it on to Dr. Joaquin for a quick presentation.
Yep, just I think Elizabeth's going to pull up a couple slides for me. Thank you, Marisol. Again, before we get started with the wrap-up session, I wanted to share a couple of things with the attendees. Again, thank you for being part of this event today. If you enjoyed spending time with us in New Jersey as much as we did spending time with you, there's a couple of CE events that you might be interested in coming up in the near future. One at Zufall, we have on February 15th, another great CE course with Dr. Gordon Christensen, To Crown or Not to Crown, When and How. This is another free offering that we are able to provide through our partnership with Delta Dental and the Clinical Excellence CE series. The next thing after that that you might want to put on your calendars is on the next slide, and that is the Oral Health Coalition's conference. So some of the great speakers that you have had the opportunity to hear today will also be presenting at that conference, and that's happening on March 22nd. So I invite you to join for that as well if you are interested in hearing more about what's happening in New Jersey and earning some credits. So Dr. Brand will be joining us shortly, and I think in the meantime, I will ask Dr. Hornsby to, you know what, we'll pause on that because there's Dr. Brand, so we'll just throw it to her. She is the Queen of Rural Oral Health. That is her official title, and we are glad to have her help us with wrapping up today's conference. Thank you, Dr. Brand.
Well, thank you, Sam. And good afternoon, everyone. I have this incredible challenge of providing for you a summary of the presentations and discussions that we have heard during today's 4th annual Rural Oral Health Conference, focusing on diversity and inclusion, addressing the needs of marginalized populations in rural communities. The objectives of this final session, entitled Next Steps for Rural Oral Health, are to help the learner summarize the role of diversity and inclusion in meeting the needs of marginalized populations in rural communities, construct a relevant action plan leading to positive change in their communities, and use the knowledge gained to identify their next steps for action. As I reflected on this assignment and these objectives, and as I began preparing my remarks, I must share with you that I felt my role in helping us meet those objectives was going to be quite the challenge. After all, today we have heard from 24 excellent presenters and had opportunities to have thoughtful conversations with them led by our moderators. How was I supposed to pull all of this incredible information and the abundance of resources shared with us into a brief, meaningful, and useful summary? So to organize this session, I thought that perhaps we could consider those presentations and our discussions in light of the 3 objectives identified for this session in our conference agenda, and you see those there. And we would be thinking about, how does diversity and inclusion impact oral health? What should we keep in mind as we're developing actions to address these challenges? And what are some specific actions we can take to promote equity and inclusion? So for our first objective, we're looking at summarizing the role of diversity and inclusion in meeting the needs of of marginalized populations, we are really challenged to consider how diversity and inclusion impact oral health care. And several of our sessions today provided background and conceptual frameworks for us to further our understanding of diversity, equity, and inclusion. In her keynote, Dr. Brown described the impact that diversity can have on oral health using her very powerful experiences. She challenged us to explore aspects of diversity and formulate a personal understanding of diversity and inclusion as we begin this work. Dr. Hornsby explained to us where New Jersey's rural areas are to help us understand how rurality impacts the health challenges and opportunities in New Jersey communities. He also talked with us about the need for programs that address the unique needs of migrant and seasonal farm workers. Dr. Monopoly shared some very useful definitions of DEI. You can see those in his presentation. He also suggested that at a community level, rural local leaders must embrace intentional strategies to nurture demographic inclusion and promote dynamic local economies. Drs. Demira, Friedman, and Hatim shared what I think for many of us has been new information and a very new way of exploring oral health. Their views about the impact of religion and culture on oral health. They encouraged us to explore and debate the impact of religiosity and spirituality on patients' oral health, and they described some positive associations between religious beliefs and health outcomes. Our second objective was to construct a relevant action plan leading to positive change in our communities. And what are some of the overarching concerns that we should keep in mind as we develop action plans for positive change? And again, Dr. Brown suggested that as we seek to address diversity in our communities, that we think about promoting diversity and developing this plan from two perspectives: the patient populations that we serve and the providers who care for them. Dr. Chalmers shared with us some very useful CMS data about oral health by race and ethnicity, age, rurality, and other variables, and encouraged us to use this data to inform our planning efforts as we seek to improve programs and address diversity and inclusion in rural communities. In her presentation, Dr. Taiwo encouraged us to consider the state as a partner when developing this action plan or any action plan. She summarized for us the resources of the New Jersey Department of Health and how the department can support efforts to address workforce challenges and promote diversity and inclusion, working with the primary care office and the State Office of Rural Health. She also outlined the state's efforts to use 3RNet and the National Health Service Corps as part of workforce efforts. Dr. Monopoly, again from CareQuest, shared with us a number of important constructs to consider as we develop these action plans. For example, key rural health organizations should be prepared to lead and support these efforts. In our planning efforts, we should adopt policies and strategies that improve accessibility and availability for primary care and specialty services such as extended hours or child care services as a way to reduce these barriers. And he also reminded us to reject one-size-fits-all policies. Zill and Allen's presentation provided an overview of the National Health Association's very useful framework to achieve health equity, and it outlined 8 strategic priorities, a framework that might be adopted by other organizations. And in addition, they described the National Rural Oral Health Initiative, which focuses on policy, communications, education, and research, also through a diversity and inclusion lens. Dr. Renee Joskow shared with us an overview of a new report from NIH and the U.S. Department of Health and Human Services, Oral Health in America, Advances and Challenges. This has a lot of data that can help to inform our work and raises basically challenges and opportunities for us to consider. If we're looking at the third objective for this session, how we develop specific actions to address these challenges. There were some specific things that our presenter said we might consider doing. Like Dr. Brown said, we need to create diversity brochures and literature and share them with our stakeholders. She suggested that we employ community health workers and community dental health coordinators. And this was an action that was also encouraged by Dr. Grover, who talked about community dental health coordinators and encouraged the use and consideration of social drivers of care. Dr. Hayes shared with us the state's successes, such as Dial a Smile to connect people to care. He also highlighted that an FQHC in New Jersey was the first in the nation to host and graduate a class of community dental health coordinators. He describes the state's success in obtaining HRSA oral health grant, which allowed the state to hire the first state dental director in 30 years. And he described the importance of creating a state oral health plan and talked about how New Jersey's plan covers the years 2020, 2022, and 2027, but goes on to talk about the need for frequent updates and revisions. Dr. Ciernecki provided us with some tools and strategies for oral health care providers who are serving patients with disabilities. And Dr. Monopoly suggested an action that we leverage students and other academic partners in these outreach activities. In terms of next steps, Alan and Zill, again from NRHA, talked about their Health Equity Council, which was created to highlight the needs and concerns of rural underserved populations and includes a multiracial, multicultural, LGBTQIA, veteran, and homeless population focus. And they suggested that other organizations have created effective groups similar to NRHA's council, and also other organizations might consider this model. Dr. Barefoot from my old agency, Health Resources and Services Administration, suggested that as we consider next steps, we think about improving oral health outcomes, that we might want to engage HRSA, and he described HRSA's programs that address and support oral health. And he provided us with an entire page full of helpful resources and links to explore as we expand access to oral health care using federal resources. And so just these are some of the highlights and some of the key takeaways that I gathered from today's discussion. And perhaps the most compelling next step for us would collectively be to commit to capitalizing on this momentum and building to promote rural diversity, equity, and inclusion in New Jersey and across our nation's rural communities, and use this opportunity to advance oral health. And frankly, great to have you all with us today, for you are the champions for this work. I don't know if we have time for a few questions, folks.
Yes.
Thanks, Sam. Well, since we have time for a couple of questions, I really wanted to follow up with Dr. Monopoly. Mike, what would you say is the most important consideration when addressing DEI in our organizations and our areas of influence?
I think I would go back to, and we heard it a couple of times today, intentionality. That it's really, nothing really happens or moves unless you're very intentional about it actually happening, and in that intentionality to develop specific achievable goals with specific achievable plans to get to those and reach those goals. And it's always best when those goals are integrated into performance indicators, either through monetary reimbursement or other ways that there's recognition for reaching the goals. But I think
great suggestions for including in our action plan. Yes, our action plans. Another follow-up that I wanted to have an opportunity to do is with Dr. Diamera. In your presentation today, you described engaging oral health and diversity, equity, and inclusion from what is, I think, a new perspective for many of us, spirituality. And I'm just wondering, if we're interested in pursuing this kind of engagement, who do we seek out as our partners?
That's a good question. I think every, at least organized religion, would have some resources, the local churches, synagogues, mosques usually have somebody who's coordinated in kind of an outreach situation, and they probably would be the best people to reach out to.
Great, thank you. And one other question, Dr. Christensen, the information that you presented was new information for many of us and suggests new and emerging strategies for dental caries prevention and management. And what should we expect in the future from your microbiologist perspective, and what should we be watching for or be ready to engage around?
There we are, unmuted.
Yes.
What we need to do more than anything else, Marcia, is to publish this information. The people that know me know that I'm very get really absorbed. I'm a nerd, and I tend to keep forcing myself forward because I want to answer all the questions and to know what's going on. But we are partnering with the University of Utah in order to accomplish this, to try to get the word out to people. The message that is so impressive to me as I've worked in this area the last 18 years is the sheer numbers of organisms in a lesion. Sheer numbers. We're talking millions of organisms on the pinhead. And what we find in many of the dental curriculums is things are very mechanical. And we really need to think chemistry, microbiology, living biological disease. And we're, of course, after more than anything else what drives it. And this is where we want to go. We haven't answered the question. It's really hard for me to take time out and stop and get things written up and move on. I tend to be very just too much push ahead. But I would like to recommend anyone listening that you keep in mind that I don't think there's anything in the literature that doesn't claim that dental caries has a close association with microbes. And essentially, we've got to think that way. What are you personally, what is your team doing? If you're into various techniques and products, can these survive in these microbe environments, or will they be overwhelmed by them? I would leave the answer at that point.
Thank you. Thank you. Dr. Joachim, I'm going to turn it back to you.
Well, thank you so much, Dr. Brand. I want to thank you and all the presenters that have helped us make today very informative. I want to thank the attendees that have chosen to spend their time with us listening to these important sessions today. I do want to put in a thank you for the planning committee that has helped plan the sessions and make today's event possible, as well as the technical team, the Zufall team, and the New Jersey Department of Health team. And on that note, I would like to ask Dr. Hornsby to close us out. Thank you.
Well, Dr. Joachim, I do want to thank you and the Zufall team as well in the excellent panels that you've had today, excellent discussion that you've had. As one who just held a rural health conference last week, I know how much work that goes into it, and you all did an exceptional job of getting everyone together. I also want to, just as a wrap up to what others have already said, is to stress the importance of recognizing that you can't have one strategy for all populations. And if nothing else that we have discussed today, it's important to note that our rural communities are also not, there's not one type within our rural settings. And New Jersey does have rural, but there's not just one approach to addressing the needs of rural communities in New Jersey. And so as long as we are working together, it's the the brilliance of all of the people that have been on these panels, along with others who know the rural communities best, those who are affected, those who live in those communities, working together that we can tackle the challenges that we heard about and that we talked about strategies to address today. And so I want to encourage everyone else who has been on this wonderful conference, this webinar today, to draw on what you've learned today, to connect with the partners that you heard from today that provided information to you that will help in the work that you do on a day-to-day basis, and to remember that none of this work can be done in a silo, that it has to be done collaboratively. And I'm ever, ever grateful for Zufall, who is a key partner for New Jersey Department of Health, to do the work that we do on a day-to-day basis. And so with that, I want to wish everyone a great holiday coming up for Thanksgiving. And I thank you again, Dr. Joachim and team, for a wonderful session. I hope that all will be well in the coming week and in the weeks to follow. And finally, remember that I always have to do this pitch, that COVID is still around. And so if you have not gotten your bivalent vaccine, please do so. If you haven't gotten your flu vaccine for this year, please do so. We have higher than regular levels of flu transmission in the state. And we certainly want to make sure that all communities, but in particular our rural communities, are protected. With that, thank you so much. And I hand it back over to Dr. Joachim. So goodbye.
We're done. Thank you.
All right. So long all. Bye.